Good evening, Dr. Gourav Siwas, sir. Myself, Dr. Ayushi Gaudani, and it's my honor to have you here for the interview in our platform, Know Your Calling. Uh, Please give us a little bit of a general introduction about plastic surgery, as it is very complicated. It sounds very complicated and a meticulous branch, and it's one of the most sought after branch of any surgical aspirants. So, can you please give us a little bit of general introduction about it?
See, the basically today we are gonna talk more about the introduction of this branch because we don't know what plastic surgery is. Even after getting into the branch, we don't know what does a plastic surgeon do. So I don't think for a fresh MBBS graduate, it's so easy like what we do, what all we can do, and what are the various sides of a plastic surgeon. It's one of the very few branches who are never taught in our MBBS curriculum. We never talk about them because, like, when we are in MBBS, we are like, oh, plastic surgeons are super specialists. But there are few 6-year courses in our curriculum, na? And for
Mm.
taking them beforehand, we should have a somewhat knowledge what all does a plastic surgeon do. Getting my point?
Yes.
So, like before beginning the real interview and all the questions of your other aspirants, first let you know what does a plastic surgeon do and what is plastic surgery. See, basically plastic surgery in itself means regaining back the form and function. Getting my point? And
Yeah.
it is divided into plastic surgery, reconstructive surgery, aesthetic surgery, burns, and many more. So basically this branch has very diverse subspecialties. Like in total, we have 11 subspecialties. I'll not go into detail of each of them, but we should have somewhat idea for choosing. We should be aware like where we are going. Okay, so plastic surgery can be facial plastic surgery, maxillofacial surgery, pediatric plastic surgery, where we are dealing with the clefts, where we are dealing with the anomalies, congenital anomalies. Then coming on to the reconstructive surgeries, where we deal with the onco reconstruction, post-traumatic reconstruction, breast reconstruction, okay, and reconstruction ranging from a simple fingertip injury to major reimplants, and nowadays we are also doing transplants. You might have heard about hand transplant also.
Yeah.
Then coming on to aesthetic surgery or cosmetic surgery, which in itself is a very huge branch, like in which we have facial aesthetic surgery, including rhinoplasty, blepharoplasty, cheek augmentation, and facelifts, neck lifts, all these things. Okay. Then the breast augmentation, reduction, gynecomastia surgeries, abdominoplasty, commonly known as tummy tuck, then mummy makeover surgeries. We all have heard about these things, but these are not so simple things which we think. So it's very important before going into the details of how to take, what not to take, to know about the branch. And last but not the least, burns. Burns make a very huge chunk of plastic surgery, especially in your residency. See, you might think of becoming an aesthetic surgeon, but in your residency, you'll always have to face burns. And there are various other things, other new things coming up in plastic surgery, like gender reassignment surgeries, where
Hmm.
we are transforming a male to female or a female to male in gender dysphorias. So this is a brief introduction of our branch, plastic surgery.
Okay,
I
sir.
hope
Thank-
it's clear to you also, like what a plastic surgeon does.
Yes. So, going towards the post-graduation or residency period, it's going to be hectic
Mhm.
in any branch, especially the surgical
Definitely.
branches. So, can you give us your insight about your life as a resident and especially in the first year of residency?
See, like every other residency in a surgical specialty, the life of a first year resident is very, very, very hectic. No doubt about it. Especially in the 6-year courses, the biggest
Hmm.
challenge is to understand the branch, its functioning, the surgeries which they are doing, the pre and post operative care, because we have never seen plastic surgical procedures in our college, in our MBBS time. So it becomes very difficult for a fresh MBBS graduate to, absorb those things. Like you'll be coming to see different systems, different body parts day by day, and you will not be able to absorb them, that one surgeon can do these many things. So first thing is, uh, you're not able to cope up with the diversity. That's for true. Like I myself took around 6 to 8 months to understand, oh, I will have to do all these procedures by myself, and I can do. Secondly, we are not aware of anything, what's happening, what the seniors are talking about, what they are discussing. So we feel left out. Thirdly, there are lots and lots and lots of dressings in plastic surgery. Like one may feel like it's a very cool branch with some aesthetic procedures and all that, but trust me, for a first year, it's all about ward work and dressings. No doubt, in institution like ours, Gangaram Hospital, the first year do get the time to see and wash up in OT, but that's very little part of it. The majority of time is spent doing the dressings, seeing the pre-op and post of the patients. He or she will be coming 7:30 or 8 in the morning, and minimum leaving by 8 p.m. or something, and that's a very normal. And like the 6 year courses are having very little seats per year. For example, our own institute is having only one seat per year. So because of that, for first 2 to 3 years, you are just like a first year in some unit or other. So like your routine remains the same at least for the first 2 years, and
Yes.
that's really very hectic. So you need to be mentally very prepared. But things do change. I'll not say that they'll not change. Things will change. Like as you will, grew up in seniority, so there will be less ward work, lesser dressings, and more OT exposure. You will be reading a lot, and then with all these comes increased responsibilities. So the things will shift, but the burden will increase only. It will not decrease on you. From the physical work, you will be shifting up to the mental work. Okay, and then the best part of it is that the exams are in the 5th year, the final exams. So even after passing your exam in first go, you are left with one more year, and in that you don't have to do the ward work. The scut work is very less, and you get to operate individually. Especially in our institute, we get to do very complex cases individually, and that boosts up your confidence. Like uh, like we come as a very fresh medical graduates knowing nothing about plastic surgery, and you know we move out of this institute as a qualified plastic surgeon with 1 year of experience post our exams. That means a lot. That
Yes.
makes you a complete plastic surgeon. And I guess if you have any other question regarding the life of a resident, you can ask me.
Okay. So going on to the other side, what about the positive note about plastic surgery? What are you passionate about and what you love about this branch?
Okay, I'll divide this into groups. Firstly, uh, in general, about the 6 year courses, there are very good advantages of 6 year courses. First, in this highly competitive world, we are getting into direct super speciality. So that's, I guess, the biggest advantage of a 6 year course. Okay,
Yes.
there is no need to sit for another entrance exam, no need to again cram up the competitive MCQ books. You only have to write one thesis in your entire curriculum, in comparison to doing MS and then MCH plastic surgery, where you will have to write two theses. Sorry. And from the very first day of your course, you are focused on plastic surgery only. It's not like for the first 3 to 4 years you are seeing all the systems, and then you will have to see you have to forget about every other thing and just have to focus on one thing. Okay, but obviously there are demerits also. We'll come to that afterwards. Now coming on to the things I love about plastic surgery, which I am passionate about. Firstly, it covers everything from head to toe. There's not a single organ which we are seeing. Okay. Secondly, every case, every patient is different. There are no set protocols. There are very few things which we are doing as per the protocols, because there is so much diversity in the plastic surgery procedures itself. Like, it's basically tailored on patient to patient. Even the procedures are tailored according to the needs. Thirdly, uh, like, where everyone in this medical field is trying to add years to your life, we are adding life to your years. So that means a lot to you. Like, I don't think that most of the people, most of the graduates who are listening to it will understand this right now, but I'm very hopeful that with time they'll understand what I'm trying to say. And like, that gives you the true happiness. Like, that's what makes you passionate about this branch. Okay, you get to see the miracles every day. Like, you're seeing a hand being brought in a polythene, and then after 3 to 5 days the same person is getting discharged with the functional hand. Okay, same when you are doing a gender reassignment case, like you are changing the life of a person, and many others. And the best thing about our branch is there is no gender differentiation in our branch, despite being a surgical branch. Like, it's a very big taboo that only males should opt for surgery or the surgical subspecialties. But in our branch, I I'll not be wrong if I say that the females are more than males, especially in today's era. So these are some things which I love about it.
Okay. So, shall we focus on the other side of the coin as well? So, what are the cons of taking plastic surgery, especially the 6 year courses?
See, again, we'll have to talk in two different groups. Firstly, coming on to the 6 year course.
Hmm.
The biggest disadvantage is that you have no clue of the general surgical principles when you are entering the specialty. Definitely, there is a 6 to 9 year period of general surgery. Especially in our hospital, we are giving a 6 month residency in residency posting in the general surgery. But we take it as a vacation period or a vocational period. We are not so serious about it. Even the people who are teaching us in the general surgery are not so serious about us, because they also know that we are not gonna follow their principles, so they are least interested in us. So, like, we are not having that good background of a general surgeon. Okay, and then the second thing is, a fresh graduate mind is not capable of taking such a big decision. Many a times we are just fascinated with the life of a senior reputed plastic surgeon who's earning in lakhs and driving Porsche, and doing good aesthetic procedures, and we'll think that, oh, this is the life of a plastic surgeon, we must do it. But that's not the case. I just told you that we have to begin with, and I guess doing it for decades or so, dealing all with the trauma and burns and wounds and dressings. So this is the other side of it. So we are not aware like where we are going. Thirdly, some people say, but I don't feel that 6 year is a long time. See, plastic surgery is such a huge branch with so much to read and so much to learn, that 6 years period is very, very less. Like, I have spent around 4 years and some 2 or 3 months, but I still think that I don't know anything about plastic surgery. It's such a huge branch. That is, it's an advantage also, and it's the biggest disadvantage of plastic surgery. We'll be coming on to it. Uh, and now coming on to the disadvantages or the cons of plastic surgery, as you said, like I said, it has a very wide spectrum. You cannot excel in all the subspecialties of plastic surgery. Plastic surgery has got 11 subspecialties. Even I don't remember all of them, so I can't name all of them. So there is a long learning curve, and you might need to take some other fellowships or programs even after 6 years of your training. So some people might feel this as a biggest con of taking the plastic surgery as a course. Then there is very high degree of overlap between the specialities. There's like we are doing hypospadias, even the pediatric surgeon is doing that, and even the urologist is doing that. So same is the case with many other surgeries like rhinoplasty. Even the ENT surgeons are doing that. Some people are doing their flap covers on their own. They might not know how to do it, but they're even trying, like the orthopedicians. Okay, and there are many other things. So this overlap makes it more cumbersome for us also and for them also. And the biggest disadvantage of plastic surgery, which as a plastic surgeon I feel, is the lack of awareness of what plastic surgery is. Uh, Awareness in both patients and the doctors. Even doctors don't know what a plastic surgeon do. So I'm taking this as an opportunity to tell them what a plastic surgeon does. Like we doctors, after our MBBS also, we don't know like the nerves can regenerate. We are of the opinion, oh, nerve injury is permanent. But no, like we do brachial plexus repairs in which a person with entire avulsion of brachial plexus is moving his hand again. So this lack of awareness is making very difficult for the patients to come to us, because even the doctors don't know whom to recommend the patient to. So, and some people who are more in the favor of a work-life balance and so might feel like that there are long working hours of a plastic surgeon, like even long, including long operating hours. For example, we have to operate for about 12 to 14 hours on a single case when required, and we have to sit on microscope for hours, like 7 to 8 hours at a stretch. So that makes very difficult for some people. So these are some of the disadvantages of plastic surgery.
Okay. So going on to the settlement issues. So since it has a very long learning curve, so what about the
Mhm.
settlement in different areas, like in tier one cities, or in government setup, or corporate, or setting up your own clinic?
See, the settlement after doing plastic surgery depends on you. You can open up your private clinic anytime after completing your plastic surgery degree. Nobody's gonna come and ask you how much you know, what your academic skills are, what you can do with finish, what you cannot. And if you ask me, the average years for settlement of a good plastic surgeon is around 8 to 10 years. First 6 years of residency with at least 2 to 3 years of fellowships in the fields, in the subspecialties you want to excel, because you will be comfortable settling when you know a good chunk of it. So it's not like you just have finished your degree and for fooling others you are getting settled. And if you want to settle as a aesthetic surgeon, you can open up your own clinic, but that requires a lot of money. So the you will have to take care of all these things in mind. There are various options. You can settle in government hospital, in corporates, in your own clinic. Like if you have to settle in the government setup, firstly talking about that, then you'll have to wait for the vacancies to come up, like, and that is very few in plastic surgery, because there are like only the center of excellence hospital, the major hospitals in our country, the main medical colleges in our country, who are offering plastic surgery services to the people. Not everyone is doing that. First thing is that. So you'll have to wait for the vacancies to come. Then coming on to the corporate hospitals, obviously when you are planning to go in some good corporate hospitals, you need to have a good knowledge of your subject, and that you will be acquiring after some minimum 7 to 8 years. Firstly, 6 years of residency and 2 years of your experience. So
Yeah.
that's much time you will be needing. You will have to do SR ship after your completion of your degree. It's not like it's compulsory, but nobody will be keeping you as a consultant directly, because we in the metro cities and tier one cities, most of the surgeons are there. Most of the plastic surgeons are also there. So in that case, it becomes very competitive. And in tier two cities and small towns, the opportunities are there, but along with that, the scope is also less. The equipments are very less. You'll not be getting a good microscope even to operate. So uh, that will just be a wasteful use, no? You'll be just wasting your skills also, and you'll not be happy with that. So for that, you'll have to acquire those equipments, those instruments, and then your clientage, everything. And as I said, the awareness is very less. So because of that, smaller hospitals are not hiring plastic surgeons, because nobody knows whom to refer to a plastic surgeon. Even we doctors don't know.
Okay. So going on to the after the completion of residency and experience, going on to the market issues, that is whenever you will have the competition with other surgical branches, that is general surgeons also can do some surgeries on bones. ENT, as you said, ENT surgeons can do
Definitely.
rhinoplasty. Even dermatologists can do some of the cosmetic surgeries. So, what about it, and what about the survival aspects? That is what is this all is about. That is the monetary aspect.
See, basically, you're clubbing two things. Firstly, we'll talk about the monetary aspects. Okay. See, studying and acquiring knowledge and skills is a different thing, and your monetary growth is a different thing altogether. In today's world, especially for a plastic surgeon, for a cosmetic surgeon, I must say, the monetary aspects will depend on his or her advertisement, their PR agencies. The more they will advertise themselves, the more uh, they will beautify their own self and their clinics. That will add up to the monetary aspect, because the poor patients don't know who's having the skills and who is just showing up. Okay, so now coming on to the real monetary game. See, uh, you'll never die hungry. First thing first. Okay, you're having a good monetary backup every time. Let me say you will be starting with 1.5 lakhs after completion of your uh, degree, when you will be joining as an SR or junior consultant. Okay, and trust me, after you'll showcase your skills and you'll have your own patients, then sky is the limit. Like, I know the plastic surgeons who are earning more than crores in a month. So it's I guess it's not rational to comment on it, because we can't just comment on it that you will be earning this much or that much. That will be very unfair. Okay, so it all depends how much you are passionate, how much you are knowledgeable, how much you are available, how much you are willing to come at night, do the procedures. And as the time will pass, your experience will grow, you will be earning good, you will be happy with what you earn. But definitely the earning is more in tier 2 cities compared to metro cities and tier 1 cities, because the availability of plastic surgeons is lesser in tier 2 cities. And like like in Delhi, everybody is having plastic surgery, residents, plastic surgery consultants. So the average pay one is offering after degree is 1.5 lakhs. But the same in tier 2 cities is more than 2 lakhs, more than 2.5 lakhs. So it goes same for all the specialities, I guess. It is same for a radiologist also, for a general surgeon also. Like, as you grow up, as you specialize more, the number of patients coming to you are less. That's a thumb rule, because you have a certain uh, group to cater. You cannot treat everyone. But
Mm.
on the same hand, you will be earning good because you will be giving specialized care to those patients, okay, which they are not getting from general surgeons. Now coming up to your second part of question, that is uh, how to deal with the other specialities taking over you. I hope that's what you wanted to ask now.
Yes, sir.
See, there is definitely uh, very it's a very challenging issue for plastic surgeons because there are various specialties which are encroaching our branch. Like I mentioned, few pediatric surgery, ENT. Even there are breast surgeons coming up. There are maxillofacial surgeons coming up. Okay, there are even the non-surgical part is totally being covered by the dermatologists nowadays, including hair transplant. So this is an issue, but it doesn't mean that you cannot survive in this world. You will have to aware the general people, the general public, that what does we do and why they should come to us, because they everybody is doing everything, but nobody is ready to handle the complications. So that's why it is becoming very difficult for a plastic surgeon, because nowadays we are only getting the complex cases, the complicated cases which have been made complicated by other surgeons outside. Even the MDS people are nowadays proclaiming themselves to aesthetic surgeons, to facial aesthetic surgeons. We can't stop them. It's the responsibility of our organizations, of our associations, of our government. It's not our responsibility. We can do what we can do in the best of our capacity. So sadly, this is the reality, that we are not getting simple good cases to us. In our hospital, in Gangaram hospital, we are mostly, like, more than 80% cases we are getting referred from our own hospital, and from the outside hospitals are somehow complicated and complex, and they have been complicated by other surgeons having less knowledge of the you know fundamentals of plastic surgery. For example, they will do some random flap, and then that flap will die. So we are now left with very few options, because the major options have been destroyed by someone else outside. So,
Mm.
and for example, Spanish case of Fournier's gangrene, diabetic foots, so all these things. So that's a sad reality we have to bear with, and let everybody know, because if they want to go into this specialty, they should be aware of this.
Okay. So at the end of the day, it's all about believing in yourself only. So there is no as proper number on the monetary aspect or the competition aspect. So that's all about it. And sir, what is the message you want to give to the aspirants? And there is a lot of confusion also about uh, what college to choose. What are the aspects that the aspirants should take in mind to choose a college or hospital?
See, that this I will date back to 2018, when I was about to choose a college, when I didn't know anything about plastic surgery. Frankly speaking, I didn't know what is a plastic surgeon, what does he do, what is plastic surgery. So there are various platforms, online and offline. There are multiple websites where you can see the works of a plastic surgeon. Uh, from there, you get a rough idea, like what a plastic surgeon do. So I was also in the same dilemma, how to choose it, which college to go, whether I should go for a 6-year course or not. But before choosing a college, it's very important to exclude, like, the main funda of choosing a college or a branch is by exclusion. You should always exclude where not to go, what not to do. Like, if I have three choices in my mind: orthopedic surgery, general surgery, plastic surgery, firstly I should choose what I shouldn't do. That will make our choice a little bit easier. Secondly, while choosing a college, uh, talk to their residents. it's very easy nowadays to talk to the residents of some particular college, ask about the patient load, the diversity of cases. Like if you are doing plastic surgery from a center where they are doing only some aesthetic cases, then you are seeing nothing. You're not seeing reconstructive surgery, you're not seeing burns, you're not seeing, you know, proper plastic surgery, you're not seeing any flaps. Then it's just a waste of your 6 years, and you'll just be regretting it. So it's very important to ask the residents out there what all cases they are doing, what's the diversity, whether they are happy with the diversity or not, whether they are seeing everything which is written in the book. Not everyone can do everything, but most of the things, like in what I all mentioned to you just before, we at our institute in Sir Gangaram Hospital, we are doing almost everything which I just mentioned. We are doing aesthetic surgery, we are doing reconstructive surgery, we are doing gender reassignment surgeries, we are doing pediatric plastic surgery, we are doing everything, breast to lower limb to upper limb to reimplantation, we are doing everything. So I am very happy with, I just inquired about these few things, like whether they are having good equipment and, you know, microscopes, so that their training is good. In this era, if you are not being trained on a microscope, being a plastic surgeon, then definitely there is something lacking in your training. You need to cover that up. And for that, covering that up, you will need to get further SRships, fellowships. So the course which has to be ended in 6 years, the training which should be of 6 years, will take you 9 to 10 years to complete. That's
Yeah.
just waste of your 3 4 more years. And you should ask for academics, whether somebody is teaching you. And see, if you are going in a 6 year course now, it is very important to ask for the department, how the professors are, how the seniors are, how's the, you know, culture of the department. But if the department is toxic, like, see, 3 year course and 6 year course are slightly different in this case. In a 3 year course, first 6 to 8 months are you are just learning and learning. You're not aware of anything. They passes by. The last 6 to 8 months, you are just preparing for your exams. They also passes by. So you are just left with 1.5 year to, you know, uh, to see all the department politics and the torture which the seniors and the toxicity which they infer to you. But in a 6 year course, it's very different. Like, you have at least 4 years when you have to deal with all these things all together. So it's very important that the environment in your department is good, it's tolerable, it's friendly. Like in our institute in Sir Gangaram Hospital, the environment is very student friendly. Like, we come as a fresh medical graduate knowing nothing, and we pass out as, you know, a certified plastic surgeon with some experience, doing all the cases independently, capable of doing all the cases independently, almost all, including microanastomosis, including gender reassignment surgeries, including reimplantation, and including aesthetic surgeries. So I don't think a resident can ask for anything more than that in the 6 years. So it's very important to ask them that, because I I personally believe that you will not be wanting that their your professors, your seniors just look up to you as a fresh medical graduate for all the 6 years. Then your progress will be hampered. First thing is that. Secondly, your personal life will also be going in the same direction with your professional life. In those 6 years, you will settle, you will marry, you'll have your personal responsibilities, you'll have your social responsibilities. You should have time for that. I'll not say that we as residents are always free. Definitely not. But after first 2 years, life is pretty much balanced. You can give time to your parents, you can give time to your wife or your husband. Obviously, I will not say that you can think of planning a child in your residency. Definitely not. As a female, definitely you cannot afford to do that, because that will take up around 1.5 years of your uh, residency, and that will be a lot more to ask. Obviously, nobody will say anything to you, but these are your choices. And lastly, you should always ask for city, your stipend, because you have a family to feed. You will have your wife or husband to feed. You will have to cater to your social needs, to your economic needs. So stipend should be asked. Okay. And I guess I have covered most of the things which you should be considering while choosing a college. Uh, I forgot the second part of your question.
No, this was it. You have beautifully and perfectly expanded my vision about plastic surgery, which was very much entitled that I thought during my UG days or before UG days, the plastic surgeries are almost entitled to nose jobs only. So it's perfectly, it's
Basically, in
perfectly
today's
out of.
era, it's not like you just can't rely on your plastic surgery training. Let
Hmm.
me just elaborate a bit. You'll have to do fellowships because in today's era,
Hmm.
even if a patient is coming to a plastic surgeon, he's not just asking for a plastic surgeon. He will ask you, what is your subspecialty? Because
Hmm.
patients, are half taught nowadays. They are getting some raw information from the internet, which is telling you the best this surgeon, best that surgeon. Every surgeon is the best surgeon according to Google, and the amount they pay to Google. So that is a that is a different world altogether, which we don't have to discuss here in this meeting. So it is very important for your betterment and for your patient's betterment that you should not stick to general plastic surgery. You should subspecialize. There are various
Hmm.
subspecialties. Let me uh, name a few because the aspiring candidate should know about it. Like there is aesthetic surgery, there is hand surgery, there is pediatric plastic surgery, there is maxillofacial surgery, there is facial plastic surgery, there is oncoplastic surgery, there is breast reconstruction surgery, diabetic foot, gender reassignment surgeries. These all are some of the fellowships available for a plastic surgeon, which they should consider in an microvascular surgery. So it all depends on you where you want to subspecialize. You must learn everything, but with the time you must subspecialize yourself in one thing or other, because in today's era you cannot survive on only general plastic surgery. See the people who did general surgery 20 years before, even they had to do you know MCH or DNB in some super specialty. How can we think that just being a general plastic surgeon we can survive after 20 years? We cannot. So before choosing plastic surgery as a career, you must be aware of all these facts. You must be prepared for long working hours, for long operating hours, sitting on the microscope for 6 to 8 hours at a stretch, for long learning curve, and for studying. Like we all have a myth that surgeons don't need to study. But trust me, the game is entirely different with plastic surgery. The basic book which we have has got 6 volumes. We need to study all the, anatomy, physiology, everything. Apart from uh, our basic things, this is the least required things. So we'll have to study a lot. We do study a lot. So you just can't opt for plastic surgery. Oh, thank God, I'm just out of MBBS MD race. I'm opting for it. That way, you'll not be able to survive. It's a harsh reality, but it is the reality. So I hope they get to know something out of it.
Yes, no, definitely. They're not something, but almost everything about plastic surgery is beautifully covered by you, sir. And it was my absolute pleasure having you here. Do you have any crisp, short message for our aspirants?
Before taking any 6 year course, ask yourself whether you are prepared for it or not, firstly. And before taking plastic surgery, ask the residents out there what plastic surgery is, how the college is, and whether they are happy or not. Because, like, failure is always more torturing than regret. Sorry, less torturing than regret. Failure is always better. I don't want any of you to regret after taking some specialty, either plastic surgery or some others, because the competition is very high. I don't want some of you to take plastic surgery and then leave the course in between and then again start preparing, because that's not a you know easy job nowadays. So please inquire beforehand only. Ask us before taking plastic surgery. Me or any other resident anywhere in the country, do ask them before taking it up. I don't want you to regret afterwards in life. Never. You can have my number, or you'll you'll have any plastic surgeon on Facebook, Instagram. It's not a difficult job to find some residents nowadays. Do ask them, and do ask what a specialty does, because plastic surgery is the least explored one among the residents, because we are not taught. We have never been taught in the MBBS curriculum what a plastic surgeon do. So that's all from my side. If you have any other question, if anybody who has joined wants to ask anything, they can ask.
Okay, I guess there's no other question as you have covered everything almost perfectly. So thank you, sir, and we'll meet you on the other side of the table shortly.
Sure, ma'am. It was my pleasure to comment on our specialty. I hope people get more and more interested in plastic surgery, and we get to see good, even better plastic surgeons day by day. Thanks a lot.
Okay, sir. Thank you.
Okay. Good night.
Good night.